If you do a diagnostic cardiac catheterization, the patient usually goes home the same day. That's standard of care. But many interventionalists have been reluctant to send patients home the same day after a PCI. Now in JACC Interventions, researchers report on a meta-analysis of same-day discharge after PCI versus overnight hospitalization. They searched the PubMed database, Embase, and the Cochrane Library for relevant literature and found 13 studies, of which 5 were randomized and 8 observational, of same-day discharge after PCI. The data were pooled using a random effects model. The primary outcomes were incidence of total complications, major adverse cardiovascular events, and rehospitalization within 30 days. Here's the outcome. More than 111,000 patients were pooled, and interestingly, the outcomes were similar for total complications for MACE and rehospitalizations. But now it gets interesting. The strategy of same-day discharge compared with overnight stay after PCI had an estimated odds ratio of 1.2 in randomized and 0.67 in observational studies. Similar results were found at 30 days post-PCI. These are surprisingly mixed results, and thus the researchers conclude that there is considerable heterogeneity across published studies about same-day discharge with overnight stay. This, coupled with the low event rate, suggests that an adequately powered, multi-center randomized trial comparing same-day discharge with overnight stay would require a sample size of somewhere around 17,000 patients, which of course would cost a huge amount of money. But because of the low event rate found in this analysis, same-day discharge after uncomplicated PCI seems a reasonable approach in selected patients. In an accompanying editorial, Dr. Kriton Mavromatis points out that most patients had low-risk single-vessel disease. PCI was done in stable angina or low-risk acute coronary syndromes. Few patients had comorbidities, and they were all straightforward procedures. The editorial also points out that 10 to 20% of the patients were converted to an overnight stay. My take on all this is that we are probably overdue for discharging selected patients after a straightforward PCI and letting them go home the same day. But we also need to be prepared to keep some patients who cannot safely return home until the next morning. I'm Peter Block, and this is a CardioSource Heart Minute.